Hey y'all, I am gonna wait a few minutes before I get started with what I have to talk about today. Okay. Hope y'all are doing pretty good. Hey. Y'all come on in, come on in. I know it is super early, well not super early, but it's early for a holiday week. Some people are probably out shopping, some are maybe prepping for the holiday food. As you can see, I am at my office. I am at work. Yes. So, I wanted to get on here really quick and discuss a couple things about the real world phlebotomy and in school phlebotomy. The difference on what you experience in the real world versus what you experience at school. When you're in school, you pretty much just learn the procedures, the safety rules. You learn all the tips of what to do and what not to do. I'll put it that way when it comes to not just testing, but while you're also in the office. And every office is totally different on how they do things. But when you're in the real world, you're actually working at a facility, you don't learn. Some of that stuff goes out the window. I'll put it that way. Sometimes you forget some of the key components, but what you do learn in the real world is you learn patience. You learn how to communicate properly. And you also learn a lot about, I would say, problem solving. Because if anybody's ever worked in customer service, period, you have to understand that when you are in a office and you're drawing blood for a patient, or you're at a hospital and you're drawing blood for a patient, these people come in and they are sick, so they don't feel good. They are going to have attitudes. They're going to be upset. They don't want you to touch them. So that is going to teach you patience and understanding. You will come across some kids that are also fearful, and some of them are frightening. Some of them are just bad and hard-headed though too. But you'll come across those when that happens. But that will teach you communication, especially when it comes to kids. You have to be able to come down to their level and try to understand where they are, so that way you don't freak them out more when it comes to you actually drawing their blood. Hello everyone, TLG. It's Marie. Thank you for joining on. I'm just talking about the difference between classes and the difference in the workforce. In the classroom, I don't know if you seen my other live, I was telling you that in the classroom, I was excited. I was ready to stick people. It was super easy. I had no nervousness at all. But when I actually got the job and I went into my first room to draw blood, I was shaking. Okay? I was super nervous. And that's normal when you get started, but you also have to be mindful of who you are communicating with and who you are not communicating with. In my class, my community class, This is one of the things that we talk about when it comes to interacting with the patient. If you go in there with an attitude, it's not going to go well. Okay? They can tell when you are rushing. They can tell when you are upset. They can tell when you don't want to be there. So if you go in there like that, when you have to draw a patient's blood, they are not going to trust you to draw their blood. They are going to run away. They're going to have an attitude with you. This is their favorite thing to say. You got one time. You got one stick, and that's it. That's all. One stick. That's it. So you have to be mindful of how you approach patients. Some of them are super sensitive, and some of them are super scared. Some of them, I've had patients, it was an elderly lady, and she was super scared of needles, and she was just super scared. And when I was drawing her blood, she kind of moved, and so I had to stick her over again. Unfortunately, that didn't help. But you have to be very, very sensitive and very empathetic and understanding. You cannot go in with, oh, I just wish they would hurry up and just let me do this. Or they acting like they just don't, like you. I understand the frustration a little bit, but sometimes you have to actually take in consideration what they might be going through. They might have just lost a loved one. I've had plenty of patients come in and tell me that they lost their brother or they lost their mom. I lost my mom while I was working. So I know exactly how that feels to have to try to go to work and still think about someone that you lost that is dearly to your heart. So be mindful of how you go into an office, how you approach patients. You want to be very clear. You want to explain everything to them. Let them know, hey, my name is so-and-so. I'm with Purpose DNA and Health. I've come in to draw your blood. It's only going to take a few minutes. Like, give them the rundown step by step of what it is that you are supposed to be doing. That's communication, okay? You may run into some issues where you have to solve some problems. A lot of patients are going to ask you things that it's not really in your scope of practice as far as drawing blood. They want to know what this does to their body, or why they didn't get this appointment or something like that. So like, you have to be able to solve problems without stepping outside of your scope of practice. So for instance, I had a patient where he was wondering why he didn't get his prescription refilled. And I don't know anything about no prescription refills. That is not my scope of area, okay? Hey, everybody, thank you for joining. But what I did do was I helped him solve an issue, because he had a situation where the doctor changed his prescription and he didn't know. So he thought he was supposed to get it a certain time, and it wasn't that. So all I did was I contacted the nurse, had her look into it, and then he was able to get his problem solved. And that made him trust me more whenever he came in to get his blood drawn. So it's all about how you communicate with your patients when it comes to drawing blood, and how you help them. Be patient, compassionate. Don't let what you have going on at home or outside of work dictate how you treat people when you get into the office, because you don't know what they're going through and they don't know what you're going through. So try to keep everything as professional and as kind as possible. Sometimes it's hard when you're not in a good mood. You probably don't feel good yourself, but sometimes we just have to fake it. Unfortunately, sometimes we just have to fake it until we can get it done. I guess, put it that way. Everybody is different. School is so different from actual working in the field. And now let me tell you this. Sorry, that's not coffee. So, in school, in the classroom, you will learn that there are certain ways that you are supposed to do this. And some of you have probably seen this. Phlebotomists will pop off that glove part of their finger and try to find a vein. That is so not compliant. That is so a safety hazard. You are not supposed to do that. Do not do that. Please do not take off your gloves. Don't find a vein without gloves on. Here's the key reason why. You need to learn how to figure out how to find that vein with the gloves on. Because let's say you go into a room, if you work at a hospital, and this patient has shingles, but you can only feel the vein without the glove on. So now you just contaminated yourself, anybody else that comes in contact with you, or whatever the reason may be. A lot of people don't think about what's on people's skin when they go to touch them, but there's all kinds of different things that can happen to people's skin. So make sure whenever you touch the patient that you always have gloves on. Do not pop that glove off to feel for the vein. Please don't do that. What else is some other things? On the exam, it's very key that you definitely label the tubes in front of each patient. Make sure you verify that they are, so of course you want to verify before, but also once you get the names on the tubes, make sure that they are spelled correctly, date of birth is the same and everything like that, so they can verify it if they're able to. If not, then you need to look at their wristband to verify that you wrote the correct information on those tubes, okay? So that is one of the few differences I've learned from school versus real world. So in my community, my school community, this is what we teach. We teach you communication, proper filing, proper identification, pretty much everything that is on the exam that you will be tested on is what we go over in our school community. So if you would like that information, since we are here on TikTok, you simply only have to message me the word study. Send me a message that says the word study, and information to join the community, school community, will be available to you. If you are someone that you are trying to study for your certification alone and you need some help and some guidance and it's not sticking, the community is available. I do one-on-one sessions with my students. I do group sessions with my students. There's plenty of flashcards. There's plenty of worksheets. There's two different versions of practice exams available. So you'll definitely be ready for the exam. Okay. So inbox me the word study to get access to it. You have a 7-day free trial where you can go in and peek and see if it is a good fit for you, or you think that you can utilize it inside of the study community. Also, you may be an audible learner like myself. I like to listen to certain things versus actually reading it all the time. But I also learned that if you read it and listen at the same time, it sticks better as well. So I have that available in the community. I also have visual learning, so you can see a few things in lecture, slideshows, and there's glossaries, medical term. We are in medical terminology right now. We're learning the medical terminology. So if you want to jump on in, just inbox me the word study and you will get access to it. And we can go from there. I'm not going to hold you guys up long. I got some work to do because, as you can see, I'm at my office. And I know y'all got stuff to do for Christmas. So have a very Merry Christmas. And I will see you guys later.